How is your T-score from a DEXA scan interpreted? When you undergo a DEXA scan, which stands for Dual Energy X-ray Absorptiometry, the results provide a T-score. This score compares your bone mineral density to that of a healthy young adult, typically around age 30. This age is significant because it is when bone density peaks. The T-score tells you how many standard deviations your bone mineral density is above or below this reference point. So, how do we interpret the T-score? A T-score of -1.0 or higher is considered normal. This means your bones are healthy, and you have a low risk of fractures. If your T-score falls between -1.0 and -2.5, you are classified as having osteopenia. Osteopenia indicates low bone mass, but it is not low enough to be classified as osteoporosis. Even though osteopenia is less severe, individuals in this range still face a risk of fractures, so it is essential to assess fracture risk further. If your T-score is -2.5 or lower, this indicates osteoporosis. In this condition, bones are significantly weakened, leading to a high risk of fractures. It is important to note that the lower your T-score, the greater your risk of fractures becomes. For instance, each 1-point drop in T-score roughly doubles your fracture risk. In practice, a T-score alone does not determine treatment decisions. For individuals with osteopenia, healthcare providers often use a fracture risk assessment tool called FRAX. This tool considers clinical risk factors along with the T-score to estimate the likelihood of fractures over the next 10 years. If this risk is deemed high, treatment for osteoporosis may be recommended, even if the T-score is above -2.5. DEXA scans typically measure bone density at the hip and spine, which are the areas most susceptible to osteoporotic fractures. The test is quick and painless, usually taking about 5 minutes to complete. However, it is essential to have a qualified healthcare professional interpret the results, as conditions like arthritis can affect T-score accuracy. To monitor changes in bone density over time, repeat DEXA scans are generally recommended every 2 years. In summary, your T-score from a DEXA scan provides a standardized measure of bone density compared to a young healthy adult. This information is crucial for diagnosing and managing osteoporosis and assessing fracture risk. Always remember to combine T-score results with a clinical evaluation for personalized care.